Hey, this is Dr. Tasha Rogers, and I am back with Dr. Tasha After Dark. Okay, so I want to talk today about something that is really plaguing our community, and I think that people really don't know what direction to go in and how to fix the problem. And some of y'all sometimes forget that your girl is a board certified physician and surgeon. So I had to throw the scrubs on today to remind some of y'all, okay? But at the end of the day, I want to talk to you guys about how to best prepare for surgery. Now, and it doesn't really matter what surgery in general. A lot of us are going into the hospital and we're hearing complaints. She just went in for a simple hysterectomy and she died. She just went in for whatever and she died. Now, understand, there are situations and circumstances that we can't change. Like, somebody throws a blood clot or somebody has an emergency, somebody has a heart attack, there's bleeding. There are some things that we cannot prevent. And it's part of the risk of surgery, right? This is why when you decide whether you're going to have surgery, the benefits should always outweigh the risks. Okay, people are, oh, just take it out. No, not just take it out. Yeah, you might be having a heavy period, every month. We can fix that. We can do other things. There are other modalities. Just take it out could potentially cause you your life. So what we want to do is we don't ever want to bring a gun to a knife fight, right? So we want to do what we can do. We want to do the best we can do, doing as minimal as possible. Now, there are going to be people who require that surgery. Sometimes there's no way around it. I'm sorry. I know you don't want to hear that. No, every herb in the world ain't gonna fix you. You just need the surgery. Okay. And this is various surgeries I'm talking about. So I want to talk today about how to best prepare yourself for surgery. Because yes, there are things that we need the doctor to be on their game. We need the nurses to be on their game. But you as a patient, you also have a checklist. You have a responsibility, sis and bro. This is not just for women. This is for anybody having surgery, cosmetic surgery, GYN surgery, heart surgery. It does not matter. If you are going into hospital and you're planning on having surgery, let's go over what your responsibilities are, in my professional opinion, so that you come out with the best outcome. Okay? Now, this is not guaranteeing you a good outcome, but it's you doing your part so that you come out with the best outcome. Okay? Now, the first thing in your mind, just like if you were going to run a marathon, right? If you were going to run a marathon or prepare for a thing, prepare for a pageant, whatever it is you were going to do, the reality is you start prepping for it, right? Okay, well, surgery should be no different. All right. So as soon as surgery is a possibility, as soon as they're like, well, I think we're going to have to operate, even before you get a date, when everybody's working out the particulates, you start in your mind, okay, it's time to start prepping. Time to start prepping, okay? Because you want to get your body as conditioned and as strong as possible. You're asleep during the surgery, so like your brain doesn't know. But I'm sorry, like your mind doesn't know, but your brain and your body does. Surgery is rough, okay? So you have to prepare and get yourself as conditioned as possible. Now, how are we gonna do that? Now, get a pen, okay? Get a pen, because I'm not putting all this in the description. Get a pen, girl. The first thing we want to do, and bro, the first thing we want to do is you want to start looking at what medications, not medications, what herbs and supplements that you're taking. And we want to limit anything that's not absolutely necessary. So what does that mean? And if you have an herbalist, it's best to go to the herbalist and then discuss that with your doctor as well. Because like me, there are some people like, I'm on Black Don Quan, all types of craziness. Baby, I don't walk around with that in my back pocket, but what I can do is I can get on the internet and I know what to read on the internet. I know what is credible. These are some, you have some herbs that will cross with medications, and can cause further bleeding, can cause thinning of your blood. We don't want these things, especially if you're going into surgery. So the best thing to do is to kind of get consultation and say, okay, I might take this odorless garlic or whatever it is you take because I don't want cholesterol, 2 years from now. Well, let's peel back off of that. Let's peel back off of that. Let's stop taking that for a while. We're going to stop taking it now, and we're not going to start until 6 weeks after surgery. So any non-essential supplement that you take, stop taking it. Okay. And if it's something that you feel like, no, I don't feel like I can stop taking this, I want to continue to take it, again, have a conversation with your herbalist as well as your physician and make sure there are no co-reaction type of things. I mean, what was it? I think even if you are like on turmeric, everybody's on turmeric. Turmeric is a great anti-inflammatory, but turmeric has a little bit of a component of a blood thinner. And so if you're on turmeric, they're like, limit how much collard greens you eat. You didn't know that, did you? So you got somebody who love collard greens. They eat them things every day and they take their turmeric supplements every day. And then we can't figure out why they're just kind of oozy in surgery. So it's just minor things like that that can cause you significant issue. So just pay very close attention. People get caught up in the word natural. It's natural. It's organic. It's natural. Girl, so is cocaine, but it ain't necessarily a good idea. Shout out to my cocaine takers. We're not judging you. Okay. But at the end of the day, I say that to say, don't get caught up in, oh, it's natural, so it's going to be fine for me. That's not the case. Okay. So be very mindful about keeping things to a minimum as far as medications are concerned. If a medication is absolutely necessary, you need to be taking that. And if you're not sure, you need to have a conversation with your doctor. This is the time to get into relationship with the person who's going to be doing your surgery or managing your case. Some situations people have, you may have a cardiologist, but then you may have a cardiothoracic surgeon. They may not be the same person, but whoever is managing the medicine of your condition, you want to be in relationship with them. Hey doc, should I be doing this? Hey doc, you should be comfortable and you should be in a relationship with them. If you feel like, I don't want to bother them, I don't want to do this, I don't want to do that, well, should you really be going to surgery with them? Because it really is a relationship, a relational kind of thing. You're going to depend on this person to keep your family updated, to make sure your family's comfortable with your progress, to be open and honest. If you can't be open and honest with them, then that says a lot about your relationship. And will they actually have that level of transparency with your family that you need them to have when you can't communicate with your family? Make sense? Makes sense. Good. Okay. Now, in my opinion, and this is a medical opinion, the biggest prep that you can do is lifestyle. Okay. I mean, hydration, nutrition, and physical activity. Now, when I say physical activity, if you have never been to the gym in all your 33 years, do not make 2 weeks before surgery the time you go buy the gym membership. That is not what I'm saying, okay? I'm saying you need to tank your body up. The best thing that any of us can actually do is walking. Walking decreases your blood pressure. It decreases your blood sugar. It decreases your anxiety. And it actually increases the serotonin, which is your happy hormone, girl. So walking. When I get overwhelmed, when I get stressed, I walk. I keep my earphones on because sometimes I see people that I know, sometimes I see you guys out, and it's not that I don't want to talk to you, it's just that that's my time. That's my private time. That's my meditation time. So walking is very important to your well-being. You want to improve your water intake. You may have a health condition that restricts how much water you can drink. Bear that in mind. But if not, and you don't have any restrictions, you want to hydrate these blood cells up. You want to hydrate your body. You want to hydrate your organs. You want to hydrate. So that is, I would say, about 80 ounces a day. Make sure you're getting in at least minimum 80 ounces a day of water, just straight hydrating. You don't have to sit and gulp 80 straight, throughout the day, but you want to make sure you're getting your water in. You want to decrease your caffeine. Again, caffeine is going to increase your jitteriness, your anxiety, and it actually kind of dehydrates you a little bit as well. So we want to decrease that caffeine. Anything that's going to make your body not function optimally, let's cut that out, okay? You want to take your multivitamins. Now, people say, what kind of vitamin should I take? A multivitamin, a regular, old multivitamin. It does not have to be anything fancy. I don't know. I think like, I think a relative like picked me up some like regular 40 plus multivitamins. It can be one a day Centrum. It can be, whatever. Ritual vitamins are pretty good. I took those before, but they gave me too much damn energy. I thought my heart was going to jump out my chest. I was like, what the hell going on? Ritual vitamins and a cup of coffee? That's like a natural Red Bull. I can't do it. I'm too old for it. I ain't interested in it. But the ritual vitamins, they're that girl. But it doesn't have to be anything expensive. Just go and get a one-a-day Centrum. Don't get gummies. Them damn gummies are 98% sugar, 2% whatever it is they're trying to give you. Grow up. Stay away from the damn gummies. Grow up, okay? And give them to kids. Not even them, but grow up. Okay, so a multivitamin. Please make sure you're taking your vitamin D. Y'all know how I feel about vitamin D2. I feel like it's a difference. Some people can't tolerate D2. I have a patient who's like, oh, my bones ache when I take D2. I don't know. But at the end of the day, D2, D3, if D3 is all you can get your hands on, D3 is what's over the counter. People always inbox me, what is the brand of D2? It's no brand. D2 is by prescription only, and I'm sure they're generic. It is by prescription only. Let me say it again. D2, tongue pop, is by prescription only. D3 is what you get over the counter, is what they're selling you online, is what they swear in the guide. Oh no, it's, child, if it ain't by prescription and coming from the pharmacy, it is D3. It's okay. I'd rather you be on D3 than nothing. But let me explain something to you. You increase your risk of obesity, depression, stroke, heart attack, all cancers, and every medical problem, COVID, long COVID. You increase your chances of suffering from everything, okay, when your vitamin D is low. And 82% of African Americans suffer from low vitamin D. So get that vitamin D up as best you can before you get on that table, okay? So that's something to consider. So a multivitamin every day. D2 is going to be once a week. D3, that's usually once a day. Get your hands on whatever you can get your hands on, but get that vitamin D into your system, okay? It is extremely important. Like, I'm all about it. I don't play about my vitamin D2. I don't care what. You can come to my office with vaginitis. You're going to find yourself with a prescription of vitamin D at that pharmacy, as well as with your antibiotic, okay? I don't play about that vitamin D. What's that movie where the lady used to kill people who wore white shoes after Labor Day? I'm not that bad, but I'm a little bit that bad. I ain't fitting to hurt nobody, but you will be judged if you ain't on vitamin D. I'm just saying, okay? So I takes it very seriously. Also, having balanced meals. I think a lot of us feel like it's a flex that we can Instacart every day. We can DoorDash every day. We had Applebee's. We had Juicy Crab. And it's a shout out to these restaurants. I'm not dragging these restaurants. I'm coming to a point. Stay with me. That, we've gotten to a point where we're financially comfortable enough. I don't have to I don't have to cook every day. I can buy my stuff. You could, but why would you? Let me explain something to you. Whether you guys know it or not, there is a food company that all restaurants get their food from. From who these folk over here, the Cheesecake Factory, all the way up to Ruth's Chris. Baby, they all get their food from the same place. I don't know whether Raheem in the kitchen cooking or whether Pierre is in the kitchen cooking, but it all comes from the same place. Now, it might be seasoned a little different. They might have some fancy sauces on it, but it's all the same food, okay? And it's all inflammatory. Do not indulge in inflammatory and processed foods while you are waiting to go to surgery. Please do not do it. If you got the money and you door dashing and you ain't about to cook and you about that life, you could always hire a meal prep service on Instagram. Desi Date Night. Shout out to Desi if you're in the Atlanta area. Does private chef services. You call her, she will actually bring your meal prep foods to your home. The only thing you have to do is warm them up and eat. Okay, so get some balanced meals in your life and stop with this processed junk, okay? Not that you can't have a burger every now and again when you want one, but I'm sure Desi will make you a burger too. Not that you can't have a wing every now and again, but like come out of that. Let me explain how inflammation in your body works. When you have a lot of inflammation and there's a bunch of inflammatory cells floating around, they start attacking your organs. Now, if you're about to go into surgery, that is probably one of the most physically challenging things that you'll ever have to do. And I'll explain why you don't already want something attacking your body. It's just like going for a fight and not realizing that instead of it being one of them, they got all three of the sisters over there and the mama out there dressed like a teenager because she want to get in on the fight too. Like, you gonna lose, because they gonna jump you. You don't want that when it comes to being on that surgery table. You don't want the beat down of life, okay? So you're gonna get out of your body what you put into it. And I usually tell my patients, if you have a Mercedes or a Bentley or a Porsche, one of these cars, pull up to the pump and put 87 in there if you want to. Pull up, sis, and put 87 in that car. You might get 2 or 3 street lights. You might even get home. But what you're going to get is a flatbed to the dealership. And so basically the car is saying my performance is AAA. You gave me C or D grade. I can't do what I need to do if you're not giving me what I need to have. Okay. So your body is the same way. Okay. But because it's so dynamically made, it can last for a while on D grade fuel and still give you B, C grade behavior. But would you really want to put yourself in that position prior to surgery? So do the best you can do for you, okay? As far as these fast food meals, baby, you know, I just always wonder what makes you pull up and think that you can get a fish sandwich, some French fries, and something to drink for $6 and have it be okay. Like, less is not always more. I mean, we're not judging over here, okay? Because you may have people out here who their only way that they're going to feed themselves and their family is to have some noodles tonight. Baby, I'd rather y'all have noodles than be hungry. So I'm not judging. But for my people who have choices, make better choices, okay? Because you rolled right past the Kale Me Crazy. And shout out to Kale Me Crazy. But it's only a couple things on y'all menu I can eat, so I'm not judging nobody. But y'all done roll past the healthy spots to go right to the wing spot, okay, or the burger spot, But you gotta, your mindset has to change, because who do we have on the show? It was Dr. April Spencer. Shout out April, who's our breast surgeon, and Dr. Spencer said something that has stuck with me, and I throw it at my patients every chance that I get, not guilt shaming people, but just to make you think. She said, every time you open your mouth, you're either feeding disease or fighting disease. And that conflicts me a little bit, because sometimes I do be feeding disease. But I need you to have that mindset. If you're going to go in a space and you want to come out and you want to do well, please give your body what it needs to fight for you and not against you. Okay. And now also you want to limit your sugar intake, child. Everybody's like, oh, it's only 100 calories. It's only 100 calories, but yet it's 70 net carbs for the day. Girl, stop. This is why, unfortunately, the overwhelming majority of African Americans are insulin resistant. And it sucks because, nobody teaches you how to lose weight when you're insulin resistant. Nobody teaches you how to eat. Nobody teaches you that there is prevention and you can come back from that. They don't teach you that. And when you are trying to have a healthy meal, no shade, no fuss, but healthy in the grand scheme of things is built on a white male metabolism, not on an insulin resistant metabolism. So all the things that you're trying to do, and you're like, I'm just not losing weight, because that's not your plan. That's not what you're supposed to be doing to lose weight for you. And nobody teaches that. So, and we'll do a show on that at some point. And so this is what I teach my patients who are in my metabolism management program. I don't even call it weight management, because that's not what we're doing. When we alter your metabolism, we teach you how to work with that thing, baby, the weight falls off. But nevertheless, the point is that if you want to limit the inflammation in your body, limit the sugar in your body. Okay? Now, this is any surgery. We're talking about any. I don't want y'all to forget that. Now, outside of that, let's talk about how we're going to stay safe in the hospital, okay? Because y'all like, yeah, I hear you, doc, and all this, and you could do all these things and still go in the hospital, and they're going to kill you. First of all, ain't nobody set out and come this morning and say, well, I think I'm going to do me somebody by noon. I'm gonna take them out of here by noon, and then I'm going to go have me, some ravioli for lunch. I don't think that that's necessarily what's happening in most instances, but I think that there is a skill level that we have deviated from, and I think that there's a health concern. So when you have people who are sicker, and then you have medical personnel that's not, in my opinion, as skilled or as astute as the standard used to be, it is a bad mechanism for disaster. So let me tell you how to potentially get out of the hospital safe. Okay, so hear me now. All right, so the next thing you want to do, you need support people. You need support people. What is support people? Now people are like, how you doing, girl? You need me to bring you something? No, that's not what I mean. I mean, when you are going for surgery, you need two people that will work on shifts that will not leave your bedside. Now, What does that mean? I say have two people. Nursing shifts are 7A to 7P and then 7P to 7A. Those are the nursing shifts. You need a support person who's going to have that same shift, 7P to 7A, 7A to 7P. Okay? Reason for that. And you want somebody there for you. Depending on your situation, depending on where you are, depending on what hospital you're in, depending on the demographics of your hospital, your nurse might have 5 patients, 6 patients. Your nurse might have 1 or 2 patients. I don't know. But no shade to them other patients. You're concerned about you. You're concerned about you and your health. And at the end of the day, if your nurse has an emergency down the hall and she's in that emergency, if you have an emergency, baby, she's only one person. So I always say have 2 support people. One, that other person at 7P to 7A, baby, she sleep while the other one is doing her big one. Okay? Now, a couple of things about your support people. They cannot be the neck rolling, tongue snapping, shwap bop. That's not who you want. That is not who you want. Because they don't want no heat up in here and they all out in the hallway acting a damn fool. That ain't who you want. You want the support person who is going to be perceptive, meaning being able to look at your monitors and be like, oh, her pressure's been, this, and now it's this. Oh, being able to look at your urine bag, being able to, and I'm going to tell you how they're going to know what to do. I'll tell you what to tell them. But essentially, you want somebody who's going to be calm and respectful enough to be able to work with your nurse as a teammate. What does that mean? Now, when you go into a hospital setting, if you make people feel attacked, you're done right from there. Again, nobody is setting out to hurt you or your family member. Some people just don't have a damn skill set. They just don't, okay? They're not setting out to hurt you. So what you kind of have to not be like, I know y'all gonna try to kill us up in here, so who want the smoke? No, that's not what you want. You want to say, hey, listen, I know you got a lot on your plate, okay? I know it's a lot. So let us help you. Show me how to do checks on her to make sure she's good. So if we need you, we can call you, but we're here with her. So you can spend a little extra time with somebody else. Make it seem like they are there to help. They're there to help you. They're there to help you, and they're there to help your loved one. But they need to come across like they're there to help the nurse, right? And so when you say that, be like, okay, so this bag right here, this for her urine, so this should always be clear, right? Okay, so should I touch her? Like, is it something? Okay, so like as far as her pain meds is concerned, when did she get them last? So she should get them every 4 hours. So okay, so if she needs her pain, it's time for payment. Like, do that kind of stuff to try and take it off their plate. Okay, so what's her pressure been looking like? So if it go real high or a little bit lower, then we know to call you. Okay, so we want to get her up because we know we need her passing gas, right? Okay, we're going to walk her around the room. Do your part for your loved one, but have your eyes on your loved one. Oh, I'm feeling a little bit dizzy. I don't feel good. I'm feeling nauseous. You see the pressure starting to drop. Oh, my stomach's starting to hurt. That is when you call the nurse and you say, hey, listen, so she's complaining about this. She complained. Do you think this is okay? And again, don't be like, because this is not okay. This is not what you do for a living. Calm down. Bring it on down, sis. Phrase everything as a question. Do you think this is okay? Do you think we should be alarmed? Do you think we need to call the doctor now? Nah, this ain't right. Call her doctor. You see how it sounds different? You see how it sounds from indicting to, I have some concerns. Should we address this? Type of thing. And that's how you always want to be. If you're that way, you're going to get whatever you want. You're going to get whatever you want because their attitude is she's here, she's helping us. She had an eye on this. Yeah, let's just make sure the doctor is aware of blah, 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 blah. Okay? Nothing confrontational because it's not you against them. It really isn't. Okay? And that's what you want. So as far as like looking at the vitals machines, but just be very clear to them. I'm not going to touch nothing you don't want me to touch. I'm not going to touch your stuff. Don't touch their machines. Don't touch their equipment. Don't go checking temperatures because you don't touch nothing because everything has to be recorded. So you can't just be up in there checking 15 temperatures. If you could do it, they want to record all of them. So don't touch them people's stuff. You can touch your relative. You can, get them up to the bathroom. You can change their underwear. You you can do different things like that. Or if they give you permission, hey, if you get her up to move her and you want to take the compression boots off of her legs, different stuff like that. But again, work as a team. Okay, don't come up in there like, yeah, we about to prevent y'all from killing her. Who? What? Yeah, no, no. That's always gonna be a negative. So don't do it. Now, what I will say is this. Okay, a couple of things. Now, because it's like when I record these, I'm always hearing in the back of my mind like what people are saying. We did all that and we tried and they still didn't listen and they still didn't do this. And you may have those situations, okay? And this is why I wrote. I don't know if you guys know, but I wrote a survival guide. It's called A Black Woman's Guide to Surviving Pregnancy, Labor, and Delivery. And it really takes a black woman. And I say a black woman, any woman can use this. It's not just a black woman. But again, we really have an issue in our community with women from trying to get pregnant, to getting pregnant, to staying pregnant, to delivering, and to going home safely and staying home alive. We have an issue. So in giving information like this, I wrote a survival guide. I haven't written one for just general surgery yet, but I probably will. But it's on my website, drtasharogers.com. So if you know a woman, you are a woman, you love a woman, any of those things, they need, especially reproductive age women, they need this guide. I literally take you from before you get pregnant all the way up until you get home and you're 6 weeks postpartum. So they need that information. Go to drtasharogers.com and get your survival guide. Now, let me finish giving you this one for surgery. There are going to be, and these are very rare situations, but I recognize that they're out there. There are going to be situations where you're not being heard. You are worried about your family member. You're trying to be respectful. Your nurse is like, okay, well, I'll get back to it. Things are not happening. And you're like, listen, this is not cool. That's when it's time to go up the chain of command. Okay. And again, we're not being confrontational, because let me tell you what the hospital has the right to do. Kick your ass out. They feel they can say, oh, you said what? In a second, they will call security and say, I feel threatened. You got to go. Now, how are you going to be effective for your family member if you can't come? And they will ban you for the whole visit. How are you going to be effective for your family member, your loved one, your mother, your wife, if you can't come upstairs? Okay, so bear that in mind. Now, nobody asking you to sugarcoat or, let somebody piss on you and tell you it's raining. We're not doing that. But at the same time, y'all seen those memes where you got to, type out, kiss my behind on the email and then have AI rewrite it respectfully. That's what you have to do when you're in the hospital. So the thing is, if you're like, okay, I hear you, I understand you, but we don't really feel like our questions are being answered. After your regular nurse, you have a charge nurse. Okay. Now I'm going to tell you, the nurse and the charge nurse are usually in cahoots. I'm just going to tell you. Okay. So when you speak to the charge nurse, and when all this, don't be like, so what's your name? Just be like, hi, I'm such and such. Who am I speaking with? So casually get their name and then say, okay, and you are, and she'll say the charge nurse. Mentally write that down, or have somebody sitting back there writing that down. And then explain and she was supposed to, nope. My family member was supposed to get A, B, C, D, and E. That has not happened. I have some concerns. And have it dealt with from there. If you don't feel like you heard, the next person you're going to talk to is either the nurse, they call it nurse supervisor. Okay. At least in most of the hospitals, they call it nurse supervisor. Either way, it's equivalent. Nurse manager, nurse supervisor, whatever it is. That person is managing all the nurses in the whole hospital. They're not usually in cahoots because they got too much going on, and they really just want to hear. They're going to stop and be like, so what's going on up here, to the charge nurse. So they're already going to have their side of the story. So you want to make sure you're cool, you're calm, and you can articulate exactly what your issue or concern is. Don't get into the petty minutia. Well, I tried to tell her. You done lost them, and now they figuring you petty. Okay, so stick with the facts. This is supposed to happen. That was supposed to happen. I don't know. Not really sure why it didn't happen, but it didn't happen. Now we have some concerns. Now we're afraid for her well-being. We just want some answers. We just want somebody to be able to pay attention to blah, 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 blah. Keep it that tone, okay? Now, After nurse supervisor, it gets a little dicey because it's either going to go one or two ways. The next person is either the chief nursing officer or risk management. Okay. You got one of those two that you're going to go to. Now, unfortunately, which shout out to our excellent nurses who are out there, right? But we have a whole kind of cliquish mentality sometimes where sometimes we actually can't address the issue because I have tunnel vision because all I've listened to is the people and their perspective who came before me rather than opening up to see what the whole situation is. Well, they've assessed it, so I'm going to listen to their assessment. And sometimes we lose the truth in that. Now, if you feel like, again, you've gotten up to, now risk management is not going to be, it's likely going to be chief nursing officer if you've gotten up that far. Now, at this point, you should have already spoken to your physician. Somebody should have spoken to your physician and say, hey, listen, we have some concerns. You don't have to have the nurse call your doctor. Okay, you can actually call your doctor just like y'all call and y'all be on the voicemail or you call the office. You can do that even if it's a weekend. Somebody is on call for your practice, which means when you call and leave that message, they're going to call back to whatever number you called. So you have a direct route to your doctor always. By the time, if you get to nursing supervisor and you haven't got any relief or you haven't gotten any answers, it's time to call your doctor. Bring them into the loop. They not oblivious. Come on, y'all, come on down too. Bring them into the loop. Okay. Now, the interesting thing about risk management is risk management's job is not to protect you. Risk management's job is not to have you seen or heard. Risk management's job is to minimize any how can I say this, any risks that come to the hospital. That's what they hear. So when they listen to a situation, they're like, how is this going to negatively affect the hospital? Not how is this going to negatively affect the patient? So here is the most controversial of the tips that I have for you. And understand, this is not always necessary. This is when you playing spades, this is the big joker. Do not pull her out unless you are ready to use her, okay? Do not speak about her unless you are ready to use her, okay? I will tell anybody, have an attorney on retainer prior to. Why is that? Because if you've gotten to the point where you are speaking to risk management or you're speaking to executive level medical staff, have your attorney come to the bedside. One, hospitals can be, not all of them, some of them are infamous for changing medical records. You know something happened. You saw something happen. You witnessed something happen. You were standing there while that thing happened. It's nowhere in the medical record. And nobody knows that it actually happened unless it's documented. Risk management, they're a gang of attorneys. Attorneys speak to other attorneys. So if you feel like your situation is so dire that your family member is really doing poorly and nobody's hearing you and everybody's treating this like whatever and she needs to go for further testing, oh, they're not going to be able to do the testing for 5 more hours. If you are in a situation like that, that is when you call your attorney in. Okay? At the bedside. I said it. At the bedside. Okay? And not to harass anybody, not to do anything, but again, so that you can be heard. And sometimes they can just be in the room and may not even need to say anything. But if it's like, well, is there a risk management department? Can we speak with them? And then that's when you let lawyers speak to lawyers. But again, if you can do that while you're in the hospital. But again, and understand this is a very intimidating step. Everybody's then going to step back and pull back. Ain't nobody got nothing to say. Ain't nobody coming in your room. They don't want to hear, see, nothing. When that attorney comes to the bedside, understand. That's why I say it's your big joker, because you can't come back from that. So don't go throwing that around. Don't go saying that. Nope. Only do it in a situation where you feel like you have no alternative and your family member, your loved one, is going to do poorly. And I don't mean do regular poorly, like maybe not make it up out of there if you don't pull this move. Okay. So again, this is not meant to intimidate, it is meant to protect. All right. So there's that. Then once we got out of the hospital, because we're going to assume we didn't have to do any of that. We're going to assume we didn't have to do any of that. People were responsive. You got further up the food chain, and they're like, "Oh, I see exactly what you're talking about. We can do that. We can look at that." And usually that's what's going to happen, because if you get enough eyes on it and the situation has truly been ignored, once you get all these eyes on it, people are going to start paying attention, or somebody's going to be able to explain the situation to you in a way where you'll understand it, and it'll make sense why they didn't do what you thought they should have done, because there's always three sides to a story. So, and it's very difficult when you don't understand the medicine, and sometimes we think that medicine lines up with common sense, and it does not. It does not. So in common sense, 1 + 1 is 2 all day. In medicine, that's not necessarily the case. 1 + 1 could equal 1.5. It depends. Okay. So the moral of the story is keep your cool. And yes, there is something that you can do. There is an ace in the hole, but you need to keep that ace in a hole. And like I said, if you're somebody, if I have 100 surgeries, it might be one person who needs to pull that out. Okay, so that's not something, but again, we want to have that option. But again, it's likely never going to be necessary. Okay. And now we're discharged. We're home. We're safe. We had a good procedure. Everything went well. The healing is now about to start. You can't heal that well in the hospital. They're coming in the middle of the night, because 3:00 in the afternoon is the same as 3:00 in the morning in the hospital. Okay. They coming in the middle of the night. They're checking vital signs. They checking this. They poking and prodding. They doing EKGs. They're drawing blood. The bed is uncomfortable. You're not the gown. It's a whole lot. And so you're not very comfortable. So you're not resting. So when you get home is when your recovery truly starts. Okay. And one thing that I'll say again, let me get back to nutrition. Just because you home, especially in our community, it's like, oh, child, you need to heal. You need some potatoes. No, ma'am. No, ma'am. No, ma'am. No, sir. No, ma'am. No, sir. Not today, not tomorrow, or the day after that. The heavier your food is, the more your body has to work to break it down. Baby, you ain't got the energy to be breaking down steak potatoes, sweet potato souffle. You ain't got the energy to break that down. Your body needs all that energy to heal. Okay, so I'll tell people hearty soups, a nice chicken and vegetable soup. Y'all know all the soups, but nice hearty soups, that people are going to make for you and bring over that you can eat off of. A lot of protein. You need protein to heal. Make sure you're having good vegetables, and make sure you're hydrating. Now, the most important thing, and not with soda pop or whatever it is you call it from wherever you are in the country. No. You want to drink some water. You have a little juice every now and again. Have a little apple juice every now and again, but don't go too far, okay? Make sure you're hydrating well with water. Make sure you're getting good meals and a lot of protein, lighter meals. Leave all the heavy stuff. The post-op period is 6 weeks. So for the next 6 weeks, and we want to make sure we're getting up every day. The first day you home, I always say stairs. When you're preparing for surgery, just know if you're in a 2-level house, are you going to be on the second floor, or are you going to be on the first? But we can't have half the stuff up here, half the stuff down here. Be wherever the restroom is. If you have a restroom on both floors, get it figured out where you want to spend most of your time. But the first day you home, you want to go up the flight of stairs 1 time. The second day, you want to go up and down. The third day, you want to go up, down, and up. You want to increase how many stairs you're walking. And move. The less you move, and family members are inclined to tuck you in and feed you. But that is the worst thing that you can do. You need to get up, and you need to move. Your body needs to circulate. That blood needs to circulate so that you don't develop blood clots. Okay? Because ain't nobody got time for that. You want to get up. You want to get moving. Muscles have memory. So the more that you do, the more that you move, the better you're going to feel. And it sounds crazy when you first get up, baby, that incision and that gas be on you. But after you have that pass, the more you move, the better you're going to feel. When my patients would come in post-hysterectomy, post-C-section, I could tell the ones that were moving, because when you bent over like this, you've been laying around. but when you up, you kind of got a little spunk to you. You're moving, you've been moving. So recovery is as important as the surgery itself, guys. So from the time you know that you're going to have surgery until 6 weeks after, it's a whole process. It's a whole situation. Now, I can't control what you go back to eating after those 6 weeks. That's your business. You got to pray about that. But at the end of the day, this is going to be your blueprint for getting through surgery safely. I hope you took notes. If not, you can always stop the video and go back. I want you to like and share this video, because y'all be watching the whole video, forget to like it. I want you to like and share it with anybody who you think will need it. The whole goal is to get this accurate information out to y'all to save lives and to reach people. So thank you so much for joining. I hope this reached somebody, and I hope this saved somebody. Next time on Dr. Tasha After Dark, can't